Welcome to the Biotech Whisperer channel. Our topic today is on medical digitalization and its impacts. If you are new here, we are a group of retired professors sharing our knowledge in bite-sized videos. Do subscribe and follow our channel for more updates. Let's dive into the topic for today. The current COVID pandemic that has stretched over 2 years have made work in the healthcare or medicinal industry face pretty significant challenges in need of solutions. On top of that, remote monitoring and telemedicine has gained popularity with applications like Doctor Anywhere, Whitecoat, Doctor World amongst many others. The most significant of these challenges include common issues such as rising healthcare costs, inflation due to macroeconomic issues, inefficient processes, the existence of poor access to healthcare as well as poor quality of care. At the beginning of the pandemic, there is even a rush to expedite treatment and vaccination strategies for coronavirus, suggesting the need to quickly address a lack of patient-specific treatment. We might turn around and ask ourselves if these challenges are new. The answer is both a yes and no. Some aspects about the new emerging coronavirus epidemic that turned pandemic is novel. Researchers are trying their very best to know more about how it works. Medical professionals are trying different treatment approaches. Other aspects such as rising healthcare costs, equitable access to healthcare management are the culmination of decades of shifts within the healthcare industry. These need to be addressed from a strategic angle as they have the potential to dramatically reshape how the industry functions for both the patient and the medical practitioner. We might next ask if technology, particularly in the area of health or medical technology, can the advent of these new technologies help to resolve at least part of these challenges in the next decade? We believe so. It should help improve the current challenges. Notably, these are large challenges that cannot be solved overnight or in a short term. Strategic review and adoption of new health technologies might also take time to implement. Amongst the challenges that can be addressed includes reduction of healthcare costs. Let's review the background. Globally, healthcare spending is expected to rise an annual average 5% from 2017 to 2026 and perhaps beyond. We can envision that higher drug prices, healthcare management and distribution costs to contribute to this rise. Aging is an acknowledged trend. Around the world, people are living longer on average, which is a positive development as medical advancements bring disease-related deaths down sharply compared to the previous century. The cost of provision of healthcare as people live longer will increase in the longer run to support health and active health management initiatives. In short, more medical resources, including the need for more healthcare workers, medical doctors, and supportive medical structure like hospitals, community clinics and nursing homes, will add on to the costs. We might next ask if we could do anything about these rising costs, which seems unavoidable. When it comes to solving the problem of ever-increasing healthcare costs, prevention is going to play a very important role. Preventing a chronic disease is, after all, much more cost-effective in the long run compared to treating the disease. Can technology play a role here? Specifically, wearable technology can help doctors monitor patient health remotely and intervene early and directly to prevent these costly, chronic diseases from happening or from getting worse. Wearables embed sensors allowing for the real-time monitoring of everything from activity level to blood pressure, heartbeat, and blood glucose levels. The data analytics collected in real time can help doctors monitor from afar and to raise alerts early to help the patient. Moreover, devices like Android smartwatches and Apple Watch already embed health analytics monitors. Their wide adoption is also expected to be non-disruptive to the patient's quality of life. When it comes to healthcare, a lot of time is spent asking questions about increasing or improving quality of care. To improve the care, it would mean that the patient gets the medical support and/or treatment needed for a positive outcome such as they recover from the disease. There is no easy or clear-cut solution that can be enacted in the short term. Healthcare innovations can help support this scenario. Under normal non-pandemic situations, it is already an admitted challenge that the healthcare system is drastically overburdened and chronically understaffed. The pandemic has made it worse. Some term it as part of the medical Great Resignation. Reports on fatigued healthcare workers are commonly reported in many countries. One thing for sure is that healthcare workers are always keeping their priority on patient-focused, but this priority is being stretched thin, especially when a single or a team of healthcare workers are now needed to care for much larger patient pools. This would contribute to the decline of quality of care, and in some news reports, we see that sometimes patients are turned away from hospitals when capacity can no longer keep up. While addressing the shortage of nurses and doctors should be high on the priority list, until that is sorted out, it is likely that technology will play an increasingly important role as a safeguard against error that could have serious negative effects on patient outcomes. We are a generation used to getting everything done on our mobile phones. So, why not add consulting the doctor to this list? Simply put, the introduction of telehealth and virtual or e-visits helps facilitate remote patient care access and facilitate specialist consultations for selected, less serious medical conditions. From general practitioners, GP, to specialists and even traditional Chinese medicine, TCM, herbalists, it is possible to consult medical professionals from the comfort of your own home. During the COVID pandemic, its adoption and use has been accelerated. It's clearly a godsend in the age of COVID-19, as it eliminates the need to sit next to wheezing patients while waiting for your turn to see the doctor without the need to leave your home or step foot inside a clinic. How does telemedicine work? The service requires the establishment of a virtual connection linked to the doctor or specialist via text chat, voice call or video call. Devices such as mobile phone, tablet or laptop can connect your medical practitioner and ask them questions, discuss your symptoms. After the consultation, your doctor will prescribe any necessary medications, which will be delivered to your home or at a convenient pickup location. The benefits include reduced waiting time, though it relies on how stable the internet connection. The third challenge we see is in the area of reducing inefficiencies in healthcare. Digital medical records have been around for some time, though security concerns such as reported cyber hacking of medical institutions have been associated with patient data theft. The advantages it have against low-tech processes such as paper-based record-keeping is still paramount. One could argue that paper-based records will ultimately be digitized at a later date. We have seen similar initiatives with digitalization of historical texts and literature on a similar scale. One aspect we can definitely alleviate is the need for non-productive time by nursing staff to do healthcare administration and free up the time for quality medical care. Reducing these inefficiencies will be key to addressing many of the overarching concerns plaguing healthcare. One such process in need of modernization is patient record sharing across institutions through digital means. Faxing or couriering hard copy versions from doctor to doctor or across instructions might delay treatment continuity, especially when incomplete records affect medical decisions for complex treatments. Security and accountability of the records is of utmost importance as digitalization of medical dossiers is implemented. There are efforts to explore the possibility of using blockchain to store and share patient records. This could not only allow for a complete record to be maintained but also allow for secure transmission of patient records in a way that protects patient privacy and ensures the integrity of the data. The next challenge is on improving healthcare access so that patients can benefit from major advances in modern medicine and that medical professionals have access to latest therapeutic products and innovations for their patients. Unfortunately, along both socioeconomic and geographic spectrums, healthcare access is not equitably distributed. Areas of concern include geographical availability. This could be due to distribution of the medical innovation or product in the geographic spectrum. The African nations, for instance, have been at the back of the queue for COVID medical innovations, where richer and wealthier developed nations have swept most of the available drugs and vaccines, for instance. Gavi, which is an alliance to ensure that poorer nations get their vaccines, has been an applauded effort to help reduce the constraints due to both socioeconomic and geographic distribution. After all, every Earth citizen is a living citizen of our planet. In terms of timeliness of care, it concerns the fact is patients are able to address a medical concern in a timely fashion, whether it be a life-threatening injury or a slowly developing chronic condition. Overflowing hospitals were reported in India in some media reports, and some patients have to be turned away, for instance. The suggested telemedicine might work well for some scenarios, though the insistence of patients seeing a physically available doctor might take some time to adjust and adapt. Next up is the costs associated, and if the patient have in place adequate insurance coverage to afford the costs, which might often be huge, to treat both acute and chronic illness, to avoid medical bill shock as they are on the route to recovery. Issues of geographic availability and timeliness of care are already being addressed through the use of technology today, through the use of smartphones or mobile devices such as tablets that can facilitate an appointment even when a patient cannot physically reach their doctor. The increased prevalence of telemedicine and e-visits allows patients to interact with caregivers virtually, where locations generally underserved by healthcare services. It's likely that access to healthcare will continue to be addressed by advancements in and utilization of technology. Healthcare, like almost every industry, is rapidly changing thanks to the advent of new technologies. It is expected that in the coming decade, we will see big data analytics, artificial intelligence, and machine learning come to playing even more important roles in identifying patients who are at higher risk of hospital-borne illness, post-operative infections, or other complications, enabling their providers to proactively preempt these complications from occurring. Staying abreast of these burgeoning technologies and proactively adopting the use of the technologies allows the healthcare system to better evolve itself to take care of ongoing and future medical needs by the aging populations, where hopefully this excludes future epidemics and outbreaks. Bye for now and see you in our next video. I would thank you for helping to share your love for this science channel by clicking the like button and subscribe for future updates.